All right, so today we're going to do a deep dive into a medical case. And it's a real mystery. It really shows how all the systems in the body are. They're really connected in ways that we don't always think about. So we're talking about Kounis syndrome. Have you heard of
I
this?
have.
Okay, so this is a condition that links allergies to heart problems. And I think a lot of people, when they hear that, they're like, wait a minute, allergies and heart problems? What?
Right. It sounds like two completely separate systems.
Yeah, like how could my pollen allergy possibly, you know, affect my heart?
Right.
That's kind of wild. But it turns out that an allergic reaction can trigger this whole cascade of events that can really impact the heart.
Yeah. And in sometimes very dramatic ways.
Yeah, and so we're going to break down this really fascinating case from the New England Journal of Medicine. And it involves a 59-year-old woman who is getting ready for surgery and experience some very unexpected complications.
Yeah. This case is a perfect example of how these two seemingly disparate systems can collide
Hmm.
and how an allergic reaction, even a subtle one, can have these major consequences for the heart.
So let's meet our patient. We'll call her Sarah to protect her privacy. Sarah was scheduled for a fairly routine surgery called a transsphenoidal hypophysectomy. So this procedure, it's used to remove a tumor in the pituitary gland. And in Sarah's case, this tumor was causing a condition called acromegaly.
Acromegaly basically just means that the body is producing too much growth hormone,
Okay, got
and
it.
it can have a variety of effects on the body.
Interesting. So Sarah did have some other health conditions that she was managing. She had high blood pressure and she had some joint issues.
Right. She had hypertension, and then she also had rheumatoid arthritis and osteoarthritis. She had scoliosis.
Yeah, a lot going on.
She was also dealing with obesity and obstructive sleep apnea and polycystic ovary syndrome.
So a lot of different things to kind of factor in. But, you know, none of these things would typically be like huge red flags for surgery.
Right.
Right.
They did a pretty thorough evaluation before the surgery. Her heart looked good on an echocardiogram, and a stress test didn't show any signs of problems.
Okay, so all things considered, things seemed like they were going okay. But during that first surgery attempt, things took a really sudden turn. So after receiving anesthesia, Sarah's blood pressure just plummeted. And her EKG started showing some pretty alarming changes.
It looked a lot like what you might see during a heart attack,
Right.
which is obviously a very serious situation.
Yeah, that sounds super scary. So what happened next?
So there was another interesting thing. Sarah's trachea was a bit difficult to intubate. And this can sometimes happen with acromegaly because there's sort of this extra tissue in the airway.
Okay.
But thankfully, her oxygen levels returned to normal pretty quickly after intubation. So that didn't seem to be the main issue of play here.
Okay, so it wasn't a breathing problem. So what did they do about her blood pressure and those really scary EKG changes?
Well, the team acted very quickly. They gave her medications to stabilize her blood pressure, and thankfully those interventions worked. The EKG changes resolved.
Okay, that's good. I imagine at that point there are a lot of questions like, what just happened?
Absolutely. They had to consider all sorts of possibilities. Was it a heart attack? Was it some strange reaction to the anesthesia? They really needed more information to figure out what was going on, so they made the very difficult decision to stop the surgery. And Sarah was transferred to the cardiac intensive care unit for further investigation.
Okay, makes sense. They wanted to be extra cautious.
Absolutely.
So what did they find in the cardiac ICU?
So in the cardiac ICU, tests revealed slightly elevated levels of troponin, which is a marker of heart damage.
Okay.
But her chest x-ray was normal, and a CT scan did show moderate narrowing in one of her coronary arteries.
So there were some signs pointing to maybe a heart issue, but it wasn't a completely clear-cut case.
Right, so taking all the details into account, the team initially suspected coronary vasospasm.
Coronary vasospasm?
Yeah, it's basically a sudden, intense cramp in the arteries that supply blood to the heart.
Oh, wow.
And you can imagine if those arteries suddenly constrict, it can cause some really serious problems.
Yeah, so they were thinking it was a spasm in her heart arteries. What did they do about that?
So Sarah was started on medications for coronary vasospasm and also medications to manage her cholesterol levels.
Okay.
And after a few days, she was stable enough to be discharged and recover at home, and the plan was to reschedule the surgery once she was fully recovered.
Okay, so it sounds like they were taking every precaution to make sure she was safe.
Absolutely, but there was still this big question lingering,
Yeah.
What triggered that vasospasm in the first place? And was it something that they needed to be extra careful about during the next surgery attempt?
That's a great question. It sounds like there was still a piece of the puzzle missing.
Exactly. And as we'll see, That missing piece would lead them down a very unexpected path.
Ooh, I can't wait to hear about this.
So are you ready to hear what happened during the second surgery attempt?
Yes, I'm all ears.
All right, let's dive in.
Okay, so Sarah's back in the OR for round 2. What was different this time?
Well, this time the team, they took some extra precautions. They did an awake fiber optic intubation. Basically, that allows for, more control over the airway. And then they induced anesthesia with propofol, rocuronium, and sevoflurane. They were really closely monitoring her vital signs the whole time, ready to react if anything, went south.
Yeah, because they knew that something had happened the first time, so they were like on high alert.
Exactly. But then right after they administered the antibiotic piperacillin tazobactam, Sarah's blood pressure just tanked. It dropped even lower than it had before. And on top of that, those EKG changes we talked about, the ones that kind of looked like a heart attack, they reappeared.
Oh, no, not again. So blood pressure plummets, EKG's going haywire. What were they thinking at this point?
Oh, it was a critical moment. They had to act fast. They had to rule out the most dangerous possibilities. So they quickly ruled out things like adrenal insufficiency and ventricular failure. Both of those can cause a sudden drop in blood pressure, but it still didn't totally make sense.
Right, it's like they're back at square one again with this medical mystery.
You got it. And here's where it gets really interesting. Sarah wasn't showing any of the typical signs of a classic allergic reaction.
Like, what do you mean?
Like wheezing or hives or facial swelling, none of that.
Oh, so those like classic allergy symptoms.
Exactly.
So what did they think was going on if it wasn't like a typical allergic reaction?
Well, this is where the idea of Kounis syndrome came in.
Kounis syndrome.
Yeah, it's this rare condition, but it can be life-threatening. It's where an allergic reaction actually triggers cardiac symptoms, like actual heart problems.
Well, wait, so you're saying an allergy can mimic a heart attack?
Yeah, pretty much.
Mm-hmm.
And that's why it's often misdiagnosed, especially during surgery, because patients are under anesthesia. They can't tell you what they're feeling.
Oh, right.
And if you don't see those classic allergy signs, it's even harder to figure out what's going on.
Wow, that's really tricky.
Yeah, it is.
So back in the OR, they had this new suspicion, like, could it be Kounis syndrome? What did they do?
So suspecting anaphylaxis, they immediately gave her medications like dexamethasone, that's a steroid, and they also gave her epinephrine. Epinephrine's really powerful. It can quickly reverse the effects of anaphylaxis.
They weren't messing around.
Nope, not at all. And the good news is, Sarah's EKG started to improve almost immediately after the epinephrine.
Oh, good.
Yeah, those alarming changes, they just vanished as quickly as they had appeared. So to further investigate what was happening in her heart, they did a transesophageal echocardiogram. That's a special type of ultrasound. That lets them see the heart in really great detail.
So they were looking for anything abnormal that could explain what was going on.
Exactly. And the echocardiogram, it showed no abnormalities, which really supported the idea that this wasn't, a typical heart attack.
Okay, interesting. So they're starting to rule things out.
Right.
So what happened next?
Well, at that point, they decided to stop the surgery again. And Sarah was referred to an allergist. To really get to the bottom of this medical mystery, they needed to figure out what was triggering this severe reaction. So remember that tryptase test we talked about earlier? Well, it came back positive,
Okay.
which confirmed that Sarah had experienced anaphylaxis.
So that was it.
But the question still remained, what paused it?
Yeah, right? They had the anaphylaxis, but they're like, what's setting it off?
Exactly. It's like having one piece of the puzzle, but not the whole picture.
So what did they do next?
Allergy testing.
Oh, makes sense.
They did skin prick tests for all the medications Sarah had received during both surgery attempts, and they even tested her for common allergens, just in case.
So they were really trying to cover all their bases.
Exactly. But here's another twist. All of the skin prick tests came back negative.
Really?
Nothing.
That must have been so frustrating.
It was a little bit of a head scratcher, but they didn't give up. They decided to do an intradermal test. That's where they inject a tiny amount of allergen under the skin, and this time they found the culprit.
Okay, what was it?
It was the antibiotic, piperacillin tazobactam.
The antibiotic.
Yeah.
But wait a minute, she had that during the first surgery too, right?
She did.
And she didn't have a reaction then.
You're right. It's possible that the first reaction was just more subtle, and it got masked by the anesthesia. Or maybe her sensitivity to the antibiotic increased over time. It's hard to say for sure.
Wow, the body is so weird.
It really is.
So what's even more wild is that Sarah wasn't allergic to all penicillin-based antibiotics, just this specific one.
Exactly. It was a very specific sensitivity, which is why it can be really hard to catch without doing thorough testing.
Wow, this case is full of twists and turns. So they finally had a diagnosis. But could they still perform the surgery safely, knowing about this allergy? So they knew that Sarah was allergic to that specific antibiotic, and that had caused this whole Kounis syndrome thing. But could they still do the surgery?
They could. The key was just to avoid that antibiotic.
Oh, okay.
So the surgical team, they chose a different antibiotic called clindamycin, and they used that for the procedure.
Interesting. So they were able to find a safe alternative?
Yep.
What happened?
Well, 6 months later, Sarah had her surgery, and this time everything went perfectly smoothly.
It's great.
No allergic reactions, the surgery was a success, and her acromegaly was cured.
That is wonderful news.
Yeah.
It really does make you think, though. Her initial reaction during that first surgery, it was so subtle. It could have easily been mistaken for, just a normal side effect of the anesthesia.
Yeah, you're absolutely right. And that's why Kounis syndrome is so tricky. It can be really hard to diagnose, especially when patients are under anesthesia. They can't tell you how they're feeling.
Right. So how many cases do you think are missed? Because the symptoms are so subtle. Or maybe they're just explained away.
That's a great question. It's hard to say for sure, but some experts have suggested that routinely measuring tryptase levels, that marker of allergic reactions, that maybe we should do that more often, especially in cases of, sudden heart issues during surgery.
Oh, interesting. So, have that as another tool in the toolbox.
Exactly. Because early recognition is so important. If we can catch it early and treat it, we can prevent some really serious complications, like heart attack, stroke, even death.
Wow. So, thinking back on Sarah's case, what are some of the big takeaways here? What can we learn from her experience?
Oh, I think first and foremost, it highlights the importance of a thorough medical history, including a really detailed allergy history. Even seemingly minor allergies can have major consequences.
Especially during medical procedures.
True.
Like an ounce of prevention is worth a pound of cure.
Absolutely.
Right.
And second, I think this case shows how important vigilance is in the operating room. Anesthesiologists and surgeons, they need to be constantly monitoring for any signs of an allergic reaction, even if they're very subtle.
Right, because the patient can't tell you.
Exactly. So it's really crucial to be able to recognize those atypical signs of anaphylaxis, like a sudden drop in blood pressure or changes in the EKG, even if there aren't any obvious outward signs.
It's like you have to be a detective.
Yeah, kind of.
And put all the pieces together.
That's a good way to put it.
Sarah's case also shows, the power of teamwork in medicine.
Absolutely.
It took a whole team of specialists.
Yep. Anesthesiologists, cardiologists, allergists, surgeons, everyone working together.
To figure out what was going on and give her the care she needed.
It really is a great example of that.
This has been such a fascinating deep dive. Sarah's story is really a reminder that our bodies are so complex and they're all interconnected in ways that we might not realize.
That's for sure.
So while Kounis syndrome is rare, it's something that every healthcare professional should be aware of.
I agree, especially those involved in surgery and anesthesia.
Yeah, because as we saw with Sarah, the initial presentation can be totally misleading. And time is of the essence when it comes to treatment.
Exactly. Early diagnosis and treatment are crucial.
To prevent those serious complications. Well, this has been an amazing conversation. Thank you so much for walking us through this fascinating world of Kounis syndrome.
My pleasure.
And to our listeners, we encourage you to keep exploring. This intersection of allergy and cardiology. You never know what other medical mysteries you might uncover. Until next time, stay curious and stay well.